It's been more than 2 years since our country's highest court overturned Roe v. Wade. And right now, groups are working to increase maternal health care across right here in Kentucky. Thank you for joining us here on the Night Team. I'm Alex Dieterer. Senior reporter Isaiah Kim Martinez talked to one organization funding doula services here in the state, and they tell him the need since 2022 has only become more clear.
I think Kentucky has a lot of work to do.
Work that's gotten more intensive, says Leah Jones, since Kentucky's strict abortion ban went into effect just over 2 years ago.
One of the states that has the worst maternal mortality rates.
Jones is the deputy director of Sister Song, a national activist group that's funded full-spectrum doula and mental health services for new mothers and mothers-to-be since the pandemic.
Diapers, wipes, car seats, strollers, basic essential needs.
Talking first over Zoom, Jones, a Louisville native herself, then showed me around their Louisville office this week.
This is the meeting area for community programming.
Currently, Sister Song's Birth Justice Care Fund operates in 4 states, focusing primarily on assisting people of color. Though Jones tells me this state has a unique challenge.
Race doesn't really matter when it comes to who is in need in Kentucky.
The group has spent more than $200,000 in Kentucky alone, coordinating with birth workers who let clients know what's available to them.
We also like to think of it as like a community space for folks to just be able to just feel seen, heard.
And since 2022, we're told the need for services across the board and easy access to them has only become more evident.
It's supposed to be everywhere I go.
Shanice Nelson is the founder of Anchored Beginnings Lactation Support, one of the organizations that partners with Sister Song.
I educate and counsel individuals on breastfeeding techniques.
With the only exception to Kentucky's abortion ban being to save the life of the pregnant woman, Nelson tells me in-person education is that much more essential, especially for teenagers.
They're more so judged from being young and being a mom. I think it makes it even more challenging to ask for what you need.
In April, state lawmakers passed a bipartisan bill aimed at lowering Kentucky's maternal mortality rates. Among other provisions, it certifies pregnancy as a qualifying life event for health insurance coverage and maintains a hotline for patients needing mental health services.
And make sure that this is something long-lasting for moms.
Regardless, the work continues for Sister Song.
Being a space that people want to come to.
In a post-Roe state and country. Isaiah Kim Martinez, WHAS 11 on your side.